All right, Angie, just start off with your background a little bit. How long you been a hygienist?
Okay.
Um, yeah, go ahead.
I have been a hygienist for over 25 years as a clinical hygienist, and in around 2000, I got interested in lasers. Went to a meeting that had something to do with lasers, and at that point, lasers were fairly new in dentistry, so there wasn't a lot of information being provided at that point. And they encouraged me to go to the Academy of Laser Dentistry, where I decided that that was definitely the way that I wanted to go with hygiene.
Hmm. Are you still doing clinical hygiene, or are you?
I am. I'm practicing 4 days a week most weeks. Occasionally, due to travel schedules, I end up having to only be able to work 3 days a week, but for the most 4 days a week, and then teach lasers most weekends.
So you're pretty busy then.
Yes,
You're doing
definitely
all
so.
that.
Definitely so.
Very good. All right, so let's get into kind of the benefits of lasers for hygiene.
Okay.
Go ahead.
Majority of benefits are just the fact that in the past, everything we did with scaling and rip planing on teeth, we're able just to remove the toxins and the bacteria off the tooth structure. But we left all that diseased tissue in those pockets to cause potential problems, not getting tissue attachments the way that we wanted them to. And so it never was a complete procedure until lasers came into the picture.
Hmm. And so, what is the laser actually doing? Is it just reducing bacteria? Is it actually removing the dead tissue, basically?
Well, we have to be really careful. As a hygienist, we're not legal to remove anything. However, of course, we're removing bacteria and toxins off the side of the tooth structure, so we technically are still removing things. But without removing it, we are reducing the bacteria,
Hmm.
maybe eliminating some of the bacteria. Of course, we can't really say that it kills all the bacteria either. That's
Right.
kind of a misstatement as far as what some of the laser companies are saying that they're doing. But just
Right.
to get in there and disrupt that bacteria,
Hmm.
potentially some of the bacteria is attracted to the laser tip. So it's not really removing it, it's just that dead diseased tissue is being kind of forced out when it comes to sitting down in those pockets, just not doing anything. And so the laser does attract to those dark pigmented bacteria.
Is it kind of doing what we used to call, well, people probably still do like the curettage, like you kind of
Absolutely.
that was
Absolutely. The
that was
difference
basically.
between that is curettage would disrupt anything in its path. For instance, it would take healthy tissue and diseased tissue because it didn't have any way of differentiating where it was. So as we would scrape that blade against that tissue, it would take wherever we were at with that blade and remove it. With the laser, it is so precise that it is only attracted to that dark diseased dead tissue. So when it gets to healthy tissue, it stops. So
Right.
it doesn't disrupt anything and it isn't cutting any of the tissue away, causing the problems that so many people think that it's doing.
So it's more selective,
Exactly.
basically.
Very
Yeah,
specific and very selective. Yes.
that's good. Let me see. And how does it compare to some of like the other things out there, like Arrestin and chlorhexidine, that kind of thing?
Well, I do still use like a pre-procedural rinse of chlorhexidine just to disrupt and eliminate some of the bacteria. But
Mhm.
chlorhexidine is very attracted just to certain bacteria, where the laser is not as selective. It's going to try to reach out to any of the bacteria that's present in the periodontal pocket.
Mhm.
With chlorhexidine, I think it is still good to help disrupt that. And I'm
Mhm.
not against Arrestin, but I feel that if laser is going to do the same thing as what
Right.
Arrestin can do, that I really don't need to do the two procedures, that I can eliminate one of them. And therefore, I feel that the laser is the better option. And I
Mhm.
can include it in some of the procedures I'm already doing. So it's not a separate fee. It's not, something that I'm placing down in there with a chemical. It's just light that
Right.
I'm placing down in that pocket.
And plus, I think Arrestin is pretty expensive in general for the
It
patient.
is.
It
It
tends to be.
absolutely is. And you can only use it on certain sites for so many times. And it's a little bit more of a hassle for the clinician to try to get it ready to use. The laser, as I
Right.
said, is sitting right there, part of our tools. We can just pick it up and use it.
Hmm. And from what I read about like professional irrigation with chlorhexidine, it basically helps healing quicker, but the final outcome is not really that much different, really.
Correct. Yes.
Right.
As far as that, I would definitely agree with that statement.
Mhm. Yeah. So as far as legal issues, Angie, how do the states differ, and is it quite a range of what
It really
hygienists
is.
can do?
We do have several states that are listed as no states, meaning the hygienist cannot touch a laser, no way around it. Those states, do consider things to look at when they talk about their state regulations. So some of them are starting to kind of come around. The majority of states fit into a gray area where they do not say yes, a hygienist can use a laser, and they are not saying no, that a hygienist can use a laser.
Hmm.
The state that I live in Oklahoma, is just like that. However, more states are starting to become aware that hygienists are wanting to use lasers, and so they're starting to address some of those components and looking at those a little bit closer. And then we do have a few states that are actually stating yes, that hygienists can use lasers. A lot of those already have in place that the certification is a requirement. And
Okay.
some of them do say that the Academy of Laser Dentistry is a requirement that they're looking at.
Oh, very good. Is there a single source by any chance of where hygienists can go and find out, or do they have to kind of go to their state to find out, really?
There is, in a way, there's a source. The Academy of Laser Dentistry, we do try to keep up with as much of it as we can, but the states change so quickly, and we certainly don't want to be responsible for interpreting anybody's state law and telling them it's okay to use a laser without them checking it out from their state board. So we do encourage them to contact their state board, know what they're asking, get that specific information since it is their license that they're responsible for. So a source, but still to check with their state board to be safe.
Okay. And as far as equipment, is it typically a diode laser that we use as hygienists, or is it other type lasers?
I would say the majority of lasers are probably diodes that most offices are purchasing for their hygienist, and a lot of that is purely because of cost. Diodes are a little bit more economic. There are Nd:YAG lasers, there are CO2 lasers that hygienists can also use as well, and we're doing studies even with the erbium YAG lasers that the hygienist maybe can use in the future. So there is the wide range, but I would agree diode lasers are probably where most hygienists are using at this point.
Is there any particular brands that you prefer, or you can't get into that?
You know, I work with all different lasers with the Academy. We're an unbiased organization, so we do not, back a certain laser. I would say that all lasers are going to work. Every single laser that's on the market will work. The difference will be is how much access we have to getting those lasers into the patient's mouth. So when the companies design them and the engineers design them, they make them work. There's no doubt there. But if we can't get a laser that has a larger tip to the distal of a second molar, obviously that laser is not going to be our laser of choice because we're having difficulty with it. It gets frustrating, and then we tend to put that tool down and say, forget it, it's not working, and I'm not going to use it. So I would say some of them that are the smaller tip lasers, not such a big tip on the end of it would make a big difference, and also to be able to consider whether they want a preset tip that they can just place on there, or if they want a true fiber optic, which is where they can put out whatever amount of laser fiber that they want to be able to reach the areas that they want. So there's those two options too, the preset tips and the free fiber optic when it comes to diode lasers. And I prefer the free fiber optic. I just feel like I have better access to being able to place the distance in millimeters of the amount of fiber out that I want, as opposed to a preset tip that might be a 4 millimeter or 7 millimeter tip. Maybe I want 9 millimeters out. So it just makes a difference as far as the area that I'm working in.
So like some of them have like basically disposable tips, is that what you're saying?
They do, yeah. They just have little preset tips that you purchase separately. That gets into another little bit of a cost issue as well. Some of the preset tips will run anywhere from $5 to $9 per tip, where the true fiber optic, you might spend $300–400 for several meters of fiber, and you just can cut off the part that you're using, and therefore it's not as costly as what those preset tips are. So that kind of is something that the offices will need to choose as well. For sterilization, obviously, those preset tips that you're going to just take off and dispose of might be a better sterilization option, but the free fiber optics, a lot of those will just come off and be able to be sterilized as well. So each company is kind of working on, depending on what each doctor or hygienist is looking for. So there's a wide range of options out there for us.
I personally played around with a AMD laser, the Picasso light. I mean, not on the patient, just on a hot dog, but just playing around with it. I mean, it's definitely cool. It's definitely a cool factor there.
It really is.
But I would definitely want to have training before using it on a patient, but
Right, and a lot of times, offices will just say, oh, here it is, pick it up, put it at this setting, and they'll go just by the guidelines that the manufacturer suggests. And that's kind of a problem in the fact that one setting is not going to work for all patients because there's so many other different things to take into consideration. And the most important one is biological characteristics, meaning tell me about your patient. If you have a patient who has very light colored skin, it's going to take a lot more laser energy to interact because they're attracted to dark pigmentation. If you have somebody with darker skin tones, that laser is going to interact a lot faster because it's seeking out the melanin and the hemoglobin in the tissue, and so you might not need as much laser energy. So those little presets that they give us on lasers, they're again are a guideline. They're not going to work for all patients, and I think that's where the biggest misconception comes in, is they pick one setting, they think that's going to work, they pick it up, it doesn't work, and they get frustrated thinking the laser doesn't work. And I think that all goes back to training. If you know what you're doing, then you have better access to be able to accomplish your task.
That was my exact thought, Angie. Like, I think a lot of people that just maybe buy a laser and just start using it and they don't get the results they're expecting, they probably think like, yeah, they don't really, it's not really doing
Exactly.
anything, right?
Yeah. Yep, that's exactly it. So that's where training, and I'm not saying just so that they would hire me to come in and teach their
Right.
course, but I'm talking about some type of background. It's like when we first went to school. There was no way we were going to pick up a scaler and start just scaling on a tooth until we knew which instrument was working in which area of the mouth. Now we
Right.
know as hygienists, when we've been practicing for quite a few years, we'll pick up any instrument now. We might place it in any area of the mouth and make it adapt to whatever we need it to do. But it's the same thing with the laser. When you're first using it, you've got to become consciously competent with that tool to be able to feel comfortable where you just pick it up and use it and don't have to really think about it. You just feel comfortable knowing what it's going to accomplish. So very important with some type of training.
Yeah, absolutely. What is the initial cost typically of, let's say, if somebody was buying a diode laser? I priced the AMD one at, it's around, I think it was 2,500. But is that typical, like 2,000 to 3,000 or something like that?
I would say those are on probably the lower end of the price range when it comes to lasers. $2,500 on up. Some of the diode lasers will go up to $18,000, $20,000. It's just all the different bells and whistles. So depending what you're looking for is going to be kind of the price range that you can find a diode with. I would say probably a good range of something that's going to have longevity and still be able to perform the task that you're looking for would be a laser right around maybe the $6,000 and $7,000 range. There's some that are fit into that category that is going to do what you need it to do, but it's a very solid machine too, so it's not going to be one that you have to replace. And I'm not saying that if you purchase one that's $2,500, you're going to have to replace it 3 or 4 times. It's just like anything else.
Right.
You get what you pay for.
Exactly. You already kind of mentioned what the maybe typical per use cost would be. It kind of depends on disposable or not. So you were saying like $8 for the disposable tip, something like that?
Yeah, it's anywhere from 5 to 9, I think, is what the studies are showing at this point, yes.
Okay.
That gets a little expensive if you're looking for, several tips. And of course, there's some people out there that are training lasers that said that anytime the tip becomes initiated, that you should change it. You should either cleave that area off or change the tip. Well, because it's attracted to that dark pigmentation, within minutes of being in a pocket, it could be, or I should say maybe within seconds of being in a pocket, it can initiate itself on that dark diseased tissue. And therefore, what they're saying then is you should change the tip. Well, if you spend a few minutes in a pocket doing that, you might go through 3 or 4 tips. There's $30 of your production that you've just had to turn around and take off. And so I just kind of guide people to be aware of that, so that if that's the concern, that you do want to make sure you take that cost into consideration. I, on the other hand, will work with initiated tip because once you go into the pocket, it will initiate itself. So you just have to be aware of that. It's one of the biggest misconsumed things with lasers is that people think that if initiated tip is there, that it's going to make it a cutting tool, and that is not true. If we have the power set low, if the tip is initiated, it still will not cut the tissue, and that is something that people can do on a hot dog or an apple, as you mentioned earlier, or tomato. See what those settings do. Do it at uninitiated at maybe 0.5 watts of power. See what happens when you try to cut, and then initiate that tip on something dark, say articulating paper, and do the same thing. You will see it's not making it a cutting tool until you start increasing that power. When you increase the power, then that initiated tip is going to make it cut faster because it's attracting there again to that dark pigmentation, which would be something doctors are going to do. If they're doing recontouring on healthy tissue, it's not dead disease, so it doesn't have that dark pigmentation. They need that initiation to help it make it a cutting tool at those higher powers of wattage. And there again, a lot of people are very misinformed about that.
Right. I can imagine.
Yeah.
So as far as billing, how is it typically billed out? Is it billed like just increasing the fee for SRP or separately, or how's that work usually?
Well, since there is no code for lasers, we do have to incorporate it into our codes. Some offices will make up their own code and be able just to put that on the side along with the scaling and root planing, or I prefer to call it periodontal therapy. I think scaling and root planing is kind of a dated term when we start looking at what patients are saying. So periodontal therapy would be more apt to what we should switch it to. But along with those periodontal therapy codes, you do have to have either increasing your fee and just put the laser into that and make that part of your procedure, or put a separate code out there that you make up that is not billable to the insurance company that may be something that the patient would be responsible. And of course, that's a whole nother ballgame when you start
Right.
talking about insurance companies, certain
Mm-hmm.
ones that you sign up for, and some of those you have no choice but to write that off. So we just have to remember that there's not a code for it. There
Right.
probably never will be, just like
Mm-hmm.
there's not a code for ultrasonic or any
Right.
other
Yeah.
tools that we use. We
Mm-hmm.
just have to incorporate that into it.
Mm-hmm. What is the typical fee? Do you know, Ange? Like just a kind of a range of what it would be?
It really is a range.
Yeah.
I would say some offices are adding maybe $30 onto their periodontal therapy codes. Some are raising it from up to like $75. So whatever
Right.
they feel comfortable with.
Mm-hmm.
Usually I try to look at what they're teaching or what they're charging for just scaling or planing right now. What is that fee? And
Mm-hmm.
then I don't expect them to jump it up to be what everybody else is doing, but I want them to be able to come up with maybe about a $50 increase from where their fee is to add the lasers. And that way it does help cover some of the cost with the lasers. So
Mm-hmm.
they're not jumping too high too fast, but they're also creating some type of value with the laser, because it is important that the patient understands that they're getting a great tool and what the laser can do for their patients' mouths.
Absolutely. So if a hygienist out there is thinking about incorporating a laser into the practice, and say their employer's maybe kind of borderline about it, like, do you have any words of wisdom of trying to convince the employer to get a laser?
Well, I would say definitely that they should possibly consider getting them to look at the Academy of Laser Dentistry website so that they can see some of the studies that have been done and see what the lasers can do, and to look at all the different manufacturers with lasers, because I really feel that if people aren't using lasers at this point, they're already behind the times.
Right.
Lasers have been around for quite a long time in dentistry. We have seen it over and over again, and many of my patients would state that they would, if we weren't using lasers in our practice, they would find another practice that is, because they feel that they have never been healthier and been easier to maintain their teeth like ever before. So my
Right.
statement that many people hear me say is I would quit dental hygiene without my laser. I just
Right.
feel that that's been that important
Yeah.
for my patients, as
Yeah.
well as making my job easier as well. So I think if they have a doctor that isn't too keen on it and they're trying to figure out what to do, encourage them to check out some of the studies and to visit with people who use lasers, just so they can show them what options they have. I have been teaching lasers for, I think, 7 or 8 years now. I have never had an office contact me after a training and say, I can't believe you wasted our time and using this laser. It does nothing for the patient. That's never, ever happened. So once they see the light, I guess would be a good choice of words, they don't turn away from it. They continue to see what other options the laser can do, and them as well as their patients are very ecstatic about it.
And I would think, coming from the hygienist too, they could say it's not just for hygiene. They could use it for just some basic soft tissue surgery.
Oh yeah, there's a lot of anything that a scalpel is being used for, a laser can be used for, and or electrosurge. We have a lot of offices that have used electrosurges in the past. The difference is electrosurge will remove thousands of cell layers, so it creates a lot of discomfort for the patient, and is basically just burning everything in sight. A scalpel can remove about 100 cell layers, so it can still make some issues for healing and delayed healing response, but the laser can be very specific and remove single cell layers. So it's very precise and it's very comfortable for the patient, and the healing response is a lot faster. So I say faster, it's not as painful. Sometimes it takes a little longer to heal, but at the same point, the patient is comfortable during that. So it just makes it a lot of options for what the doctor could use the laser for as well. Most doctors purchase a laser for troughing around for crown preps. That's a very number one reason that they buy them, and some get stuck in that and that's all they use it for, and others will actually then start expanding their options as far as what the laser can do.
Yeah, absolutely. So let's get into the training, Angie. Can you tell us about the ALD training compared to what's maybe from a manufacturer?
Of course.
Other places.
Yes. Most of the other ones are going to be specific for their laser. So they are going to teach you on how to use their laser. And they probably will give you a background just in general with it coming to physics and some of the options of laser can do. And those are awesome opportunities to take advantage of, because I don't think that there's ever too much opportunity for lasers as far as training. But it is a brief introduction basically, and it would be maybe a certification or training with that specific manufacturer. The good thing about the Academy of Laser Dentistry is that you can take a standard proficiency course and be able to be using any of those diode lasers. So it will be very specific, but at the same point, if you were to move offices or purchase another laser, you wouldn't necessarily have to go back and get that additional training on that laser, because once you have the general information, you can apply it to any laser. They could pick up whether it's a Picasso or a Sirona or BioLaser and understand and know what they're looking for just by the training that they have from standard. So even though a lot of states are not requiring standard certification, I would highly recommend any hygienist or doctor that wants to use a laser to get that, just so that they have an understanding as far as what options lasers can do. And then, of course, if they really get into it, then they can further their career with lasers and do an advanced proficiency through the academy, which gives us a lot more background information, more of the whys and everything of why you're using the laser. They can then become educators and actually be one of the recommended course providers through the academy to be able to teach courses. So lots of opportunities with lasers.
Can you describe, each one? I know they have an intro thing that's like online, right, Angie?
Right. Yeah. And the intro course, they can go on and just get the basic information as far as what they're looking for with lasers, just the information that they want, just simple background information. It's not going to give them how to use it per se, or what happens if, how are we going to correct this if there's an issue. It just gives them the simple background. The standard will give them pretty much everything that they need to know. What happens when, because the standard is going to do a tutorial portion, and then it's going to do a hands-on portion, and a lot of times most educators will provide some type of a mock exam. So it prepares you to take the online standard certification exam through the Academy of Laser Dentistry. So it just gives you all of that background information and makes you understand, what you're doing with the laser and not to be afraid of it. And then the advanced is just details. It's just throwing that much more information into the mix. You, at that point, take a written exam, you do a clinical exam, and then you follow case studies for a year, 5 case studies that then you present at the Academy of Laser Dentistry. So it's just a lot more in-depth information as far as what you do with the advanced.
And the standard course, how long is that approximately?
It's a 12-hour course. So there again, it's a tutorial information. Then we do the hands-on portion. We do some practice management. Some of us educators will incorporate that, especially if we're working with individual offices, where we can help them implement it into their scheduling and their fees and things like that. A lot of times if we're working with a large group at a standard proficiency course, you can't get into all the individual fees and scheduling because there's so many variances between offices. But you can at least give them a little bit of a guideline to know how to start incorporating it into it, and then if they want more specific training, they can contact us as well. And then there again, they take the mock exam that we provide as educators, and once they do that standard exam or the standard proficiency course, we give them a code to be able to take the online course, or the online test, through the Academy of Laser Dentistry to be able to get all that information in. Then they're considered standard certified and would receive a certificate from the Academy of Laser Dentistry.
So from my reading, Angie, it seems like the ALD is kind of the standard for training.
Of course, being backed with the Academy of Laser Dentistry, I'm definitely going to say that. I do feel like it's a gold standard, and a lot of the states are setting their requirements up according to the curriculum guidelines of the Academy of Laser Dentistry. Other laser companies are replicating that or making their courses equivalent to it, but there again, that's going to be more specific for their individual laser as opposed to all of them through the Academy. So obviously I might be a little biased as far as the Academy of Laser Dentistry being the source to go to, but I do know that several of the states are even saying that they will accept Academy of Laser Dentistry certification, and if they've had some other basic training from some of the other companies, that may not be equivalent to what they need and therefore have to go back. So I always tell everybody, if you just do the Academy of Laser Dentistry training, you're probably going to always meet the requirement as far as what your states are going to require, because they can't exceed something that's not available out there for us to teach if it's not offered anywhere.
And I would guess too, if obviously it seems like lasers are getting more and more popular through time, so states are probably going to require something, and they're going to look to whatever the standard is out there.
Exactly.
So they're probably going to look at ALD anyway, so you might as well get that certification.
And basically that's what I tell people too. You might as well. It's just going to give you that much more additional information, and you can certainly take any of those other courses. It's just extra information. Once you do a standard course through the Academy of Laser Dentistry, technically you don't have to do it ever again. So once you're certified, you're certified. But as lasers continue to change every day, I would recommend that they still do some type of course to keep up with it, because there's always little bells and whistles and little pearls that they can capture from other people teaching it as well. So that they can always try those different tools and little things that might help, tidbits of information that would help them. So to always keep up with CE courses on something to do with lasers, always of great interest.
So what you offer, Angie? I mean, you do CE courses, you do in-office training, and that kind of thing. Can you just kind of go over some of the things you
Sure.
offer?
Through the Academy of Laser Dentistry, since that's an organization that I'm backed with, is I do teach. I am one of their recommended course providers. So I can teach in-office certification courses so that they can receive the standard proficiency through the Academy by attending one of my courses. I also do speaking at larger events, the Greater New York Dental Meeting, the Yankee Dental Meeting, RDH Under One Roof. I've spoke at all of those meetings as well. Sometimes we'll do a hands-on course at those meetings. Sometimes we teach standard proficiency, just depending on what that organization wants. But it does give them an opportunity to have a little bit of a hands-on opportunity so that they can create their interest in lasers and then be able to further it if necessary. So a wide variety, anywhere from helping them implement the laser to becoming standard certified on their laser is what I try to provide for them.
So say an office, was definitely interested and they wanted to get the standard certification for everybody in the office, the hygienists, the doctors, and they wanted to, obviously implement the laser in the practice. What kind of course are they looking at? Like the overall, services you offer?
Well, as far as a hygienist, I cannot certify dentists, so they can attend my courses and they can get CE hours. I am back to provide CE hours for them as well. The doctors can attend that, the staff can attend that, and still obtain CE hours. But to certify, I can only certify hygienists or assistants as laser safety officers. So that is what my requirements are, is that I can do that. But I always make sure that they know the doctors can sit in on any of my courses to be able to attend. Right now, and truly I don't think we will ever see a state that will require a dentist to have standard proficiency through their state. I just don't think that will happen. Maybe it will, but I really doubt it. But with hygienist, I do foresee a lot of the states heading in that direction. So if they get it ahead of time, that's great. We have had a couple of states that somebody's had certification through ALD before the state made it a requirement, and then when they did make it a requirement, they actually had to go back and do it again. That would be the only time we have seen a couple of states do that. Kind of against that, I think once they have ALD certification, they shouldn't have to do it again, but of course that's the state guidelines that are coming into place that we don't have control over.
How often do you offer the standard certification course?
Actually, the Academy of Laser Dentistry, we do it at our conference every year, and it does vary in different locations. So that's one of the main places that people can go to the Academy, and it's a 3-day meeting all on lasers. So there's just tons, overload of lasers. Otherwise, we are, as I mentioned, incorporated with some of the other organizations where we actually, as part of their requirements and their course curriculums, that we do provide the standard proficiency courses for those. And then otherwise, if offices are interested, they can contact me, where I actually will schedule it with them, and it's totally on what works for their schedule and my schedule, where I actually would go to their office and provide an in-office course. I typically try to teach those on a Friday, all-day Friday and half-day Saturdays.
Okay, very good. I see you are a co-author of a textbook.
I am, and I'll never do that again. I did that once, and that's it. Yeah, it's a very difficult process to write a book.
I can imagine.
Yeah, so the book we did co-author, Jessica Bladen was actually one of my students. I was listed as her mentor, and so we decided that we would try to tackle that process together. Very difficult to write. It's easier to walk the walk and talk the talk than to put it all in writing. And then when they went to the copy editing, there was a lot of things that they were trying to change that were difficult, because as a laser, we knew that that's what it had to be. So a little bit of difficulty getting it all in writing per se, but it is kind of a source for them just to understand what options they can do with a laser. And this, to me, after they've had a course, then that can be a referral source that they can go back to. They can look at that and say, now tell us again how to do this particular part. They can look that back up, as opposed to using it for their source of, quote, training. I would hate to think that just reading something in a textbook is going to make you proficient and feel comfortable using something. I think most people are hands-on learners, and to be able to actually touch the laser and use the laser is going to give you your best options. But it's out there. At least it's a source for them to go to if necessary to get additional information on lasers.
Yeah, I mean, I would assume a hands-on would be necessary for a laser, right?
You know, and a lot of times the certain manufacturers are just providing a video. They'll give them a DVD and say, here's your DVD, go figure it out. And there again, I guess maybe because I'm a hands-on learner, that to me would scare me, to think that I'm going to watch a video and then start putting this laser in a patient's mouth. I always think about if we were doing that just with our clinical skills and hygiene, if we didn't work on real patients, or at least our typodonts, as opposed to just watching a a video and saying, okay, now you're a dental hygienist,
Go
it's the
for
same thing. You can't, yeah, you can't just pick it up and start doing it unless you have somebody standing over your shoulder, guiding you and helping you feel comfortable with using that tool. Our scalers are all based on using it against the tooth structure. The lasers are complete opposite. We aren't on the tooth surface, we're on the gum tissue. So it's backwards for us. And when we've been a hygienist for several years, that's difficult. We're creatures of habit. So one of my favorite things to say is, tell me where the tip is pointed. And they're like, oh my gosh, it's on the tooth. A DVD is not going to be able to give you that information if you don't have somebody there to help you and guide you along the way.
Right, exactly. So you're going to be anywhere, like any conventions anytime soon?
I'm actually going to be at the RDH Under One Roof in August. I will be teaching a course with a dear friend of mine, a hygienist, that is also in the process of getting her recommended course provider with the Academy of Laser Dentistry, Jeanette Miranda. So we are teaching a hands-on course. If I'm not mistaken, it is sold out for this time, but they can certainly see if they can get on the waiting list. I know that there is a list created so that they can see about attending that. And I think there's a couple other courses through that meeting that have something to do with lasers. So I would encourage them to at least get into one of those if they can. Okay.
So best way to contact you, Angie, if a hygienist out there has questions, would be...
I would say probably by my email address. I always pride myself in trying to answer emails back very quickly. So my email address would definitely be the best way to reach me.
All right, very good. Any final thoughts, Angie, about lasers you want to throw out there? Or
just as I stated earlier, I would quit dental hygiene without my laser. I cannot imagine treating patients without it. I would feel like I would be completing half of the task as opposed to really thoroughly being able to clean that pocket out to where we can get those tissue attachments to reform. So I think, as I mentioned earlier, if you don't have a laser, you're kind of already behind the times. And for the patient's benefit, we got to have lasers in our practice.
Sounds good. All right. Thank you for doing this, Angie. I really appreciate it.
Thank you. It's been my pleasure. I appreciate it as well.
I will have this up in a couple of weeks, and I'll let you know, okay?
Sounds good. Thank you.
All right, thank you. Have a good weekend.
Okay, you do the same. Take care. Bye-bye.